And so just like every Thursday, we did this last week as well, even though we were not at the station, we put the video online. Welcome, Senor Mejia. Thank
Thank
you for
you.
taking the time and being with us. If you could just give us some information about what's going on with the vaccine, testing, and other information you may have.
Sure. Uh, well, our cases in Sonoma County have nearly tripled in recent weeks, as our positivity rate has done as well. At the beginning of December, we were averaging fewer than 40 cases a day. Now we are seeing 200 to 300 cases per day. There are currently 34 people hospitalized with COVID in Sonoma County. To date, our case rate has increased to 56 per day per every 100,000 residents, and our test positivity rate is 13.7%. So it's pretty elevated. We're in the middle of a surge right now, and we're expecting that this surge will continue to grow along this month and probably start declining by the end of this month, as we have been observing in other countries. Omicron is a fast-paced variant, like fire spreading, and hopefully it will go down soon. In the meantime, we know that the best tools we have to tackle this pandemic are vaccines, and we'll continue to encourage everyone to get their booster shots as soon as possible. The good news is that we are in a much better position right now that compared to what we were last year when we were just starting to roll out vaccines. Our numbers of hospitalizations is nowhere near the level it had in January last year, nor does it compare with the increase that the Delta variant brought during the summer in 2021. We believe this is further proof that the Omicron variant, although it is very contagious, it is not as virulent as other variants of this virus. We are not seeing the negative results that we had before, which is encouraging. Our high vaccination rate is also an important reason why the results are not as bad as in other stages of the pandemic. Comparing our vaccinated and unvaccinated population shows that the unvaccinated people are 4 times more likely to be infected with COVID-19. They are also 17 times more likely to be hospitalized and 14 times more likely to die from causes associated with COVID-19. With many people testing positive these days, there is some confusion about what to do if one has contracted COVID-19. If the results are positive, the first thing to do is isolate yourself for at least 5 days. Get tested on day 5, and if the test is negative, then you can end your isolation. If you can get tested, you can end your isolation after 10 days if you don't have symptoms. If you use a COVID test at home, we need to collect that information to fight back Omicron. So please do report your results, either positive or negative, to the County Health Department, to this telephone number, 707-565-4667. Previously, I gave the line for Spanish. This is the line for those who speak English, 707-565-4667. People who are fully vaccinated do not need to self-quarantine after contact with someone who has COVID-19 unless they have symptoms. However, fully vaccinated people should be tested 5 to 7 days after exposure, even if they do not have symptoms, and should wear a mask indoors in public places for 14 days after exposure, covering nose and mouth, not just the mouth, nose and mouth, or until the test results the test comes negative. Unvaccinated people should stay home for 14 days after their last contact with a person who has COVID-19. If you have COVID symptoms, isolate yourself immediately and contact your doctor or health provider. Recently, there has been several changes to the health guidelines, so let's review the most up-to-date guide now. First, masks are required in all closed public settings, regardless of your vaccination status. There are no more exceptions to the mask requirement for stable cohorts of vaccinated people. Wearing an approved mask, such as a well-fitting N95 or surgical mask, this is still one of the easiest ways to prevent the spread of the virus. Cloth masks do not protect against Omicron as much as surgical mask, the KN95 and the N95 mask. The Centers for Disease Control and Prevention also updated the quarantine and isolation guides, shortening the time from 10 days to 5 days. So far, now talking about vaccines, we have administered more than 900,000 doses of vaccines, which means that 77% of the eligible population in our county for those 5 and older are fully vaccinated, and another 8% are partially vaccinated. Our school-based pediatric vaccination clinics resumed this week after taking a break over the holidays. Tomorrow, Friday, there is, hold on, there is listed here, I'm looking at the website of SCOE, SCOE.org. There is one in the Lincoln Abraham School in Santa Rosa from 2:30 to 5:30. Then on the 11th, which is next Tuesday, there is one from 4 to 8 at Rancho Cottage High School. And then on the 12th, there is another one on Comstock Hilliard Middle School in Santa Rosa. And please do go to visit SCOE.org to get a full list of all the schools that are going to be open along this month, offering free vaccinations for the kids that study there, for their families. And it's not just the pediatric vaccine, but all the rest of the vaccines that are available for the population that is eligible at large, first doses, second doses, third doses for those immunocompromised or boosters for starting at 12 years old now, provided that there has been 5 months since these kids completed their series of vaccination. Our 5 to 11 years old population is now 22% fully vaccinated, with another 15% partially vaccinated. So we are well ahead of our goal of vaccinating 50% of these younger children by the end of January. On the booster vaccine front, we have administered more than 160,000 booster vaccines to eligible residents 16 years of age and older, providing significant protection against the highly contagious Omicron variant. This week, the CDC approved the Pfizer boosters for children aged 12 to 15, as I was mentioning, provided that there's been 5 months since they completed their initial doses. With that said, some of our hospitals and clinics are struggling with staff shortages due to illness or the need to follow COVID protocols. So we encourage everyone to help prevent the spread of COVID in our community, but by maintaining your social distance, wearing your mask, avoiding crowds, keeping gatherings small, and if possible outside, getting your booster shot. And if you haven't already, get your first and second round of vaccinations. Please visit our website, socoemergency.org, or call us at 707-565-4667, where we can assist you with all your questions. And that's my report for today.
And I sincerely appreciate, just like we have before, the collaboration that we have going on with the county, providing information to our community. And again, we couldn't be here the last 2 weeks because the station itself was closed, but we continue to provide information online. So in the future, people can always go to my YouTube channel, Líderes del Futuro, or my Facebook page, DACA Sonoma County, where we put information that the county sends us. You just send us today the latest flyers for next week's vaccinations and testing and everything else. So that will go up into Facebook and Instagram this evening.
Rafael, and really quickly, now that you're mentioning that, we've been making a lot of videos, short videos. If people don't have the time to read or don't have a lot of time, just go to Soco Emergency. There is the, we call it Videoteca in Spanish, or video archives in English. And we have a lot of playlists there, or you can visit our YouTube channel too, where you can just follow the videos, and it's easier also than reading all the information. I understand that it can be complex. We bombard people here with information in the 15-minute segments that we have. So please do go visit socoemergency.org for further details. And take your time. They can see your videos and play them back until we get all the message. It's very important now to take care of ourselves. We're in the middle of a big surge of cases. In fact, much larger infection numbers than the previous waves. And the difference here is that although Omicron is tending to be mild, because of the huge number that is impacted, even if it's only the elderly and the sick people is the most impacted, it's still a lot of people. So let's be mindful of that, and not because I'm feeling healthy, I'm not going to be conscious around other people who can be older or people that I don't know they may have a condition. So let's not expose others. Now we're saying more and more that the mask also protects us from spreading COVID to others. And that's a way to give back to community by being respectful of other people who may have problems with their health. And we don't want to, that's what happened to us, treat others like you treat yourself. That type of thing. So let's just be mindful about it.
Thank you. And again, thank you for your time. And we look forward to our next conversation next week.
I look forward to see you here. Much to report next week.
Take care.
Thank you. Bye-bye.
Bye-bye.